So welcome to MedExam Expert. I'm Dr. Huda Naim. I'm a consultant physician and I'm also an OET mentor for MedExam Expert. And I welcome all of you to the webinar today. So today we will be discussing some of the most frequently asked questions that you ask us on our chat groups and on different forums. So we will be discussing those questions. And at the same time, we'll also be discussing some different strategies in order to tailor your study plan so that you can score well on your exam and you can just excel your exam in the smallest and the shortest time possible. So welcome on board. We see we have a lot of participants. And I believe all of you will be attempting your OET exam very soon. So what are the different questions that are on your mind? You can always ask in the chat box and we'll discuss them as we go along through the webinar. Okay. Okay. So one of the most frequently asked questions that we get on our forums is, what is the OET? Why is the OET given? And what is the basic purpose of the OET exam? So basically, OET is it is accepted as the language proficiency exam, and it is accepted by different forums, by different medical councils, like the General Medical Council, the Educational Commission for Foreign Medical Graduates, that is the ECFMG, the Irish Medical Council, and many different councils throughout the world, and even different employers and professional bodies like the Royal College of Physicians, the MRCOG, and different professional bodies. They require you to give a English proficiency exam, so that when you get on board with those professional bodies, they want you to have a certain level of English proficiency, and that is what they test with the OET exam. And if you're planning to move to any other country, any European country, or even in the Middle East, they do require you to give an OET exam. And that is done if you're not a non-native English speaker. They do require you to have a certain level of English language understanding and speaking proficiency, and that is what they test by taking the OET exam. So the second most commonly asked question was, in which countries is the OET exam accepted, and which countries accept the OET as the English language exam? So it is accepted in the United Kingdom, in USA. If you're planning to give your USMLE, if you're planning to give STEPS, then you'll have to give your USM, after your USMLE exam, you need to give the OET to get certified. Then for Australia, New Zealand, Singapore, and then for different Middle Eastern countries as well, it is accepted there as the English language exam. Okay. Now, the third most frequently asked question is about the components of the OET exam. How will you be assessed for your English language proficiency? How will you be tested for your reading, listening, speaking, and writing? So there are 4 basic components of the OET exam, and you will be tested for reading, you will be tested for your listening skills, for your speaking, and as well as your writing. And the basic aim of this exam is not to test just your English language, but also to test the skills that you require as a medical professional when you are talking to different doctors, different medical professionals, as well as with patients and the caretaker of the patients. So they require you to speak and to communicate in a very professional and in a very dignified manner. So your ethics, your empathy, and your professional demeanor also comes into account in the OET exam. Then about the scores that you require to pass the OET. So the lowest score is the E grade and the highest is the A grade. And most institutions, they require a minimum of B grade. But for nursing and for the other specialities, they might have a lower threshold. But for most of the specialities and for most of the countries and professional bodies, you do require a grade B, and that is above a score of 350 or above. So how often is the OET offered? Usually it's offered every month or 2 attempts per month. and the frequency just depends on the test centers. The bigger centers, they have more frequent attempts, and the ones which the centers which have a smaller capacity, they might have lesser attempts. So you need to check for your closest destination, your home country, and you need to see where the test is conducted and how many attempts are there. And it is conducted on paper as well as on computers. So you can choose the attempt that is feasible for you, the one you're more comfortable with, and you can check the number of attempts in your hometown. Then another very common question that we get asked again and again on our forums is about the retaking of the OET exam if you do not pass a particular subtest. So there was a lot of speculation that like the IELTS, you will be allowed to give one subtest again if you do not pass one subtest. So if you do not pass any one subtest, you'll have to give the entire OET exam all over again. So if you do not clear your speaking, for instance, you will have to give your speaking, reading, and writing also apart from your speaking. So it's not like if you do not clear your one subtest, you will have to just give that again. You have to give the entire exam all over again. So that is why it is highly, highly recommended that you give adequate time for your preparation and you prepare well once you attempt for the exam, and do not book an attempt just in haste, just that you have to give it. So I would always recommend all of the candidates to give adequate preparation time and prepare well when they try to give the exam. Okay, so before we discuss the pattern of the OET exam, if you have any questions or queries for all the things that we have discussed so far, we can answer those queries first. So if you have any questions, we can take those questions.
Regarding OET writing, I have one doubt, ma'am.
Yes, please. May I know your name, doctor? I think we've lost the connection.
Hello, can I ask a question?
Yes, definitely. Please go ahead, doctor.
My name is
What do
Taufan.
you recommend? What do you recommend, IELTS or OET for a medical professional, for a doctor?
Okay, so the pattern is different for both the exams. In the IELTS exam, you will be asked to write and speak about general topics. Okay. But in the OET exam, you only specifically supposed to communicate in your field of expertise. So doctors generally, medical professionals generally find OET easier as compared to IELTS, because it's only related to your own profession. The vocabulary is very similar to what you use on a daily basis. The communication, the form of communication, the writing, the speaking, even the text that you're supposed to read. So they are all very familiar to the context that you do on a daily basis. So I think doctors generally find OET easier as compared to IELTS. I hope that answers your question.
Ma'am,
Yeah,
I
thank you.
have in regarding writing, ma'am.
Yes, doctor.
Yeah, this whether we have to address the child as Mr. or Mrs. or only a child in reference while writing, ma'am. That I have a doubt.
Okay, so if you have a child, you would be just writing the name of the child, and you can also refer with Miss, Master or Miss. Okay,
STMS.
Miss or Master.
MISS, right, ma'am?
Yes, MIS, Miss.
Okay, ma'am. Thank you,
Okay.
ma'am.
Okay. Any other questions so far?
Yes, I have one question. Is 1 month enough for preparation if you do it on a daily basis, like spare 3 to 4 hours for OET modules, like 1 hour for
Okay.
listening, 1 for speaking and writing?
Okay, now that again depends on your level of English proficiency. How well do you communicate in English language, even on a daily basis? Now, for some people, those who've done their medical education in English, they do find it a little easier as compared to completely non-native English speakers. So if you think you're good enough in English, you have a good vocabulary, you know how to write well, you can speak efficiently in English, then I think 1 month would be good enough. But at the same time, the exam taking techniques need to be known. Okay, so if you're preparing in the wrong format, if you don't know the exam pattern well, and even if you continue to prepare for months and months, you might not score well. So you need to know the pattern of the exam, the way, the technique of the exam, as well as your English grammar and English vocabulary. So both of the things would matter at the same time. Then you would be able to judge whether 1 month or 2 months or 3 months preparation is sufficient for you, or you need more time. And then you can also take some mock tests or some self-performance evaluations. And that would also tell you whether you're prepared for the exam or you still need more time.
Okay, thank you. And how many letters in the writing portion should be assessed ideally in order to achieve more than 350 grade?
Okay. Now, again, that would depend on your English language, right? If you're a good writer, then maybe 10 or 15 letters would be enough. But if you think your vocabulary is not that good, or you need more time in order to understand the text, and you have to reciprocate in the form of a letter, and that would take more skill and more time, then you would have to write more letters. So at least somewhere between 25 to 35 letters would be good enough to be on the safe side. Okay.
So they should be assessed, or we have to write at least 25 to 30 letters a day? I mean, in 30 days.
I think that's completely up to you. The more letters you get assessed, the more better feedback you will have, and that would help you in order to improve your grade.
Okay, thank you.
Okay.
Excuse me, ma'am. Here is the sessions for nurses also.
Yes, we do provide sessions for nurses. They are a little tailored according to the pattern of the exam, and we do offer courses for nurses as well.
Okay, ma'am. Thank you.
Okay.
Ma'am, is there any difference between nurses exam and doctor exam?
Okay. The difference is in the context, in the text that you get for reading and the text that you get for speaking, the different subtests. But at the end of the day, the pattern of the exam remains the same. The pattern is the same. The components are the same. It's just the difference in the format, in the text of the different subtests. It's more suited to the nurses. So if you're a nurse,
how do you
would
prepare
be
your
asked.
candidates before taking the exams?
I'm sorry, doctor, I could not hear your question. Can you please repeat yourself?
Okay, I'm Philip from Ghana. How do you prepare your candidate before taking the exam? Do you give the candidates learning materials?
Okay, we'll get to that. I'll as we move along through the preparation, I'll just discuss that in detail as well. So any other question so far?
So should a nurse take IELTS or OET exam before he or she can travel to UK or US?
I think you are asking whether we should take the exam in our home country or whether you should take it in the United Kingdom. Is that your question?
No, please. I'm asking if should a nurse take the IELTS exam or the OET exam before he or she can travel to UK or US for practicing nursing?
Okay. For traveling purpose, you do not need the exam, but if you want to practice in that country, for that you would need the OET exam. Okay? So if you want to get yourself registered as a nurse or as a doctor, so then you would be needing the OET. Just for traveling, for tourism, or for traveling purpose, you do not need the OET.
Oh, okay.
Okay.
So after taking the exam, do you have any provision for if the person is a nurse or a doctor, do you have any provision for them? Do you provide job opportunities for the person if the person wants to travel to UK or US?
Okay, for the job opportunities, I don't think this is the right forum, and our course coordinators will contact you, and they will guide you further regarding any or job opportunities or any source of career guidance that we provide. At the moment, we're just discussing more about the OET preparation first. And then once we're done with the OET, then we can talk about the different traveling and the different registration and the job opportunities that the OET will land you with. Okay. So our course
Okay,
coordinators
thank
and our
you.
career counselors will guide you regarding that.
Okay, please go.
Okay. Let's move ahead. Now we will be discussing about the pattern of the OET exam. Again, a very frequently asked question because there's a lot of confusion on different forums when you discuss it. So basically, you have 4 subtests. You have the reading subtest, you have the listening subtest, the speaking, and the writing. So first, let's discuss the reading in a little bit of detail. So you have a reading subtest for 60 minutes, and the total marks are 442. And you need, it is equivalent to 400 marks, and you need to get a 350 or above, and in order to score a B grade. And in order to complete your reading subtest, you have 2 different parts. So the first part is the reading part A, and that is for 20 minutes. You would be given a booklet and you have to complete your reading part A in 15 minutes and you have to hand it back. And then you have the reading part B and C, and that lasts for 45 minutes. So the reading part B and reading part C is for 6 and 16 marks respectively. And then we will be discussing about the subtest in detail. So the reading part A has, it's for 15 minutes and for 20 marks, and you have 4 different passages that you have to read. And the reading part A basically tests your expeditious reading, that is your fast reading, and you have to read it quite fast. You have to read the 4 passages and you have to answer the questions from those passages. So the questions that you would be getting on the reading part A would be somewhat like fill in the blanks. You have to match the right option, and you have to first, in the first 7 questions, you have to match the right passage with the right answer. So you just have to mark whether the passage, the question, the answer for the question is in passage A, passage B, passage C, or passage D. Then in the next set of questions from question number 8 to 14, you have to complete your answer in a word or in a short phrase. And that would be all about reading part A. So it's a very short subtest, and you have only 15 minutes to complete it. And it's a fairly easier one. If you practice very well, you will be able to score a complete full score on the exam. And I think it's a very doable kind of an exam. Then in reading part B, you have 6 short passages, and there is 1 question from each passage. So there will be a question and the answer would be in that short passage.
Ma'am, please repeat part A.
Okay, I'll repeat it again. So I'll complete the entire reading and then I'll come back to reading part A. So in reading part B, you will have a question and a short passage, and then you have to grasp the answer from the passage. So, and you'll have 6 different passages, and for each, you'll have a different question. So it won't be related to each other. So every question would have a separate passage for the guidance purposes. And then the reading part C would be a longer passage, around 1,000 words. So you will have 2 different passages with 6 questions each. So you will have 6 questions, and you have to read the passage and you have to answer the questions. So there will be 2 different long passages that you have to read and answer. Okay, so I'll go back to reading part A in detail again. So for reading part A, you will have 4 different passages. So there will be a text A, text B, text C, and text D. You have to read each text and then you have to answer the questions. So the first 7 questions, basically, you just have to write the name of the text that has the answer. For example, the procedures for delivering pain relief. So in which text was it mentioned? Was it in text A, B, C, or D? So you just have to name text, the name of the text that had the answer. No details, just the name of the text. And then for questions 8 to 20, you just have to answer in the form of 1 word or in a short phrase. No complete sentences, just 1 word or a short phrase. And that's all about reading part A. Then reading part B will have a question with a short passage. You have to read the passage and you have to answer. And there will be 6 different passages with 1 question from each passage. And then the reading subtest C will have 2 long passages around 1,000 words. And you have to read the passage and you have to answer the questions corresponding to those. So how to prepare for reading subtest, the key to improving
Ma'am,
your reading score. Yes, doctor.
so total questions will be included, I think 32 in reading part.
I'm sorry, I did not.
Total, I want to say that the total numbers of questions in reading part will be 32 questions.
42. Total 42 questions.
42.
Okay. Okay, so the key to improving your reading score would be to practice. The more you practice, the more fluent you are in your reading, the faster you read, the better your score will be. And then how can you improve your score? And you can improve your reading score by improving your vocabulary, by reading newspapers, by reading medical journals. You can read different research papers, and all of them will help you in improving your medical vocabulary as well as your general English vocabulary. And you can go through different medical articles, medical related books, journals, new articles, new research papers, and all of them will help you in order to improve your reading subtest. So whenever you're practicing and you come across any new medical concept or any new English medical word, always look it up on Google, always look it up in the dictionary, and it will really help you in improving your score. So I think with that, this was all about the reading subtest of the OET. So are there any questions from reading? We can answer those before we go ahead. Any questions so far? Okay, so then the next subtest that we have to discuss is the listening subtest. Again, you have 42 questions in listening. You have a listening subtest A, B, and C. Now, the problem with the listening subtest that a lot of candidates face is that the audio is not repeated. Once you lose the track of the audio, that means you've just lost, you'll be losing marks then. So the main aim to attempt listening would be to stay completely focused, remain 100% focused, hear the audio properly, and utilize your the time that you get before the audio starts. So we'll see what each subtest is about. So the listening subtest A is basically, it is a communication, it is an audio, it is a dialogue between a doctor and a patient. So a patient would be talking about his or her medical condition, and the doctor would be asking some questions. The doctor would be giving some suggestions, maybe. He would be taking the history of the patient. So something of that sort. So they will tell you beforehand that it's a communication between a gastroenterologist and a patient, or it is a communication between a neurologist and a patient. So you will be able to understand whether what kind of a communication would be, what kind of conversation would they be talking about. So if it's a conversation between a neurologist and a patient, they will be talking about some kind of pain, some kind of weakness, some kind of weakness of one particular part of the body maybe, or some kind of pain in any part of the body. So you would be able to make out the different adjectives or different kinds of vocabulary that you would be using. So before the audio starts, you can make up your mind what kind of questions they would be talking about, what kind of conversation they would be having. Then the listening subtest B is basically a communication. It is a conversation between two medical professionals. So it's either between a doctor and a nurse. It is between two nurses. It is between a hospital staff and another hospital, somebody from the hospital management maybe. And they would be talking about a patient. They would be talking about some kind of a hospital scenario. And you have to hear the audio and you have to answer the question. So before the audio starts, you would be given time to read the question. And while you have the time, read the question thoroughly, make up your mind, read the answer options thoroughly, so that when the audio starts, you can hear the audio and you can mark the correct option. So that is all about reading part B. There will be 6 different conversations. Every conversation will be corresponding to one question, and you will be getting time to read the question before the audio starts. Then the listening subtest C. Now, this is the one that most of the candidates find very difficult, because the problem with listening subtest C is that you have to hear the audio and you have to mark the answers at the same time, and there is no pause. So it's usually a conversation of a researcher maybe, or of a doctor who is giving a talk. So the doctor just keeps on talking and you have to hear the question. After you have to read the question, hear the audio and mark the answer at the same time. So that's a little technical, but once you start practicing, you will be able to understand where you have to pause, where you have to listen carefully. So the audio corresponds to the questions and it goes in a sequence. So it does not go back and forth. It goes in a sequence, but you have to utilize those 90 seconds before the audio starts. You have to utilize them very well, and you have to read the questions thoroughly. You have to read the answer options very thoroughly, so that when the speaker starts speaking, you can automatically pick up the correct answer as soon as the audio goes on, because you will not have time to stop and listen, and the audio does not pause in between. So I think most of the candidates, they find the listening subtest C very difficult. And the reason being is that the audio and the questions just, they are correlated to each other, and the audio just continues to go on without any pause. And the audio is not repeated again either. So you have to be very, very focused at the same time. You have to read the question and answer it at the same time. So that's the thing that most of the candidates find very difficult. But it just needs practice. If once you get into the flow of answering it, once you understand the technique, how you have to answer, I think you'll be able to answer very well. So how can you improve your listening score? So usually the problem with non-native English speakers is that they're not used to hearing English audio. So since they're not used to hearing the audios to a larger extent, they don't really understand the medical vocabulary. And there's a little bit of problem with the accent. So the key to it is that you continue to exercise your listening skills. You can hear medical podcasts, you can hear news, but the ideal scenario would be to hear something related to medicine, so that you're more used to hearing medical vocabulary, and that would help you in understanding the text when you're answering the questions. Okay. So with this, we've just discussed about reading and this listening subtest. Are there any questions, anything that is not understood, or anything that requires a revision? So I can just answer those questions. Are there any questions?
No, it is not.
Okay, so somebody asked about the genuine audio, authentic genuine listening test sample videos. Okay, so one thing you can use is the OET sample tests that are present on the OET website. I recommend all of my students to always solve those, because they're very, very authentic, just accurate, in line with the main exam. So always practice those. Yes, the 5 tests that are given there, you are supposed to practice them, and that will give you a very, very accurate idea about your preparation and the pattern of the exam. So always solve those. Okay, time management. Dr. Unzila asked about the time management. So again, time management will come with practice. The day you plan about giving your OET exam, the day you make your decision that I have to give my OET exam, make sure you know the time division of each subtest, and you start practicing for each subtest according to in lines with the time slot that is given to you. So if you have a reading subtest A and you know that you will be given 15 minutes on the main exam, you have to utilize that time well. So the key to it is that in the first 2 minutes, try to skim through the different subtests in reading part A. Okay, Dr. Unzila? So in reading part A, in the first 2 minutes, try to read the 4 subtests, skim through those so that you have an idea what each subtest is talking about, and then you start solving the questions. So once you've skimmed properly, you've gone through, you've just skimmed and scanned the 4 subtests, then you can go through the questions and you can start solving the questions. instead of giving unlimited time to reading. That will not really help you in reading subtest A, because reading subtest A, basically they are judging your ability to scan, to read expeditiously. So to read fast, you have to scan something and you have to find the answer and write the answer. Okay, Dr. Unzila? I hope that helps. Okay. Yes, Dr. Amna, please go ahead.
Hello, Assalamu alaikum. Regarding, can you hear me?
Yes, Dr. Amna, I can hear you.
Yeah, okay. Dr. Huda, regarding this listening, I find part B is more difficult than C. Actually, what happens with me that in part B, three options are given, which are very similar. So how can we approach the part B? Because options
Okay.
are very close and very difficult to keep focus while listening same time.
Okay. So the key to listening part B is that you do not have to match the correct answer. You have to understand what the passage is talking about, what is the gist of the passage. Okay. If you try, all of the answers would be given in the passage, but the question generally wants you to understand what is the answer in a nutshell, what the passage is talking about in a nutshell. So, what is the one liner conclusion that you come up after reading that entire passage? So that is usually the answer. They want you to know the gist of the passage, that you understand what have you understood when you read that passage. What was that one line conclusion that you drew once you read the passage? So that's basically the correct answer. Okay, Dr. Amna? I hope that
Yeah,
answers
okay.
your question. Okay.
Thank you.
Okay. Dr. Neha asked how many marks are needed to clear the reading and listening. Okay, so ideally you should be scoring the higher you can, but the minimum would be if you're solving on your own, you're making a self-assessment, at least a 30 out of 42 would be the baseline passing score. So at least a 30 out of 42. Okay, that would be somewhat correlating to a grade B. Okay. Okay, so let's discuss a little bit about the writing subtest. Again, something that most of the candidates find very difficult. What are you required to do? So this test does not only test your English language, but it is also making an assessment of how well you communicate with your fellow professionals. So the writing subtest is basically a letter that you as a doctor are writing to another doctor. So you are referring a patient. So that patient could be you it could be a simple referral letter. You're a general physician, you're a general practitioner, and you're referring to a rheumatologist or a cardiologist or any subspecialty, you're referring to a specialist. Or it could be a discharge letter, so that the patient was already admitted in a hospital setup and now you're referring the patient back to the general practitioner. Or maybe the patient was having an emergency situation and you're writing an emergency referral letter, and you're writing that kind of a letter. So the key would be to read your set of notes that are provided to you, read them properly. You have 5 minutes before starting. Read the notes properly, and then start writing the letter. Make an assessment of what kind of letter are you planning to write. Are you writing a simple referral letter? Are you writing a discharge letter? Or are you writing an emergency referral letter? And then once you've made your decision, then you start picking out the most important key points of what you think the other doctor should know, the positive points and the negative points as well. So anything that is required for the diagnostic purposes or for management purposes, you have to mention that. And then once you made up your mind about the different ideas that you have to write in your letter, then you have to organize your ideas and then you start writing it. So writing would require practice, and you have to continue writing at least 25 to 35 letters at least. If you think you're weak in English or you're weak in English writing, then you have to practice even more. And it would be ideal if you get your letters assessed by a professional, because they will be giving you accurate feedback about where you're having problems, which mistakes you're doing. because not only will you be marked for your English, but also for your pattern of writing and your effective communication. So there's a set criteria according to against which the letters are marked. So it's always ideal if you get your letters assessed by a professional. And then you can improve your writing as per the feedback that you get. And then the last subtest is the speaking subtest. It is made up of 2 different role play scenarios. You will be performing your role of a medical professional. If you're a doctor, you will be performing the role of a doctor. If you're a nurse, you'll be performing the role of a nurse. If you're a radiographer, you will be performing the role of a radiographer, or whatever your medical professional is. And the interlocutor will be either the patient or they will be the caretaker of the patient. And you will be given 3 minutes to read your role play card, and then you have to speak on it for 5 minutes, and you will be recorded during that during that session. Your audio will be recorded, and then it would be marked later on. So you have to speak in a very professional manner, the way you would be speaking to a patient, and very, very professional, very sophisticated. You have to remain empathetic, but not overly sweet. So you have to remain professional. You have to remain just the way you speak to your patients in your normal hospital scenario. You have to speak in that way. And you have to use a clear range of language. You do not have to add any medical information on your own. You have to just use the role play cards that have been provided to you, but you have to elaborate those role play cards. You have to speak, you have to convey the role play properly. You have to convince the patient or whatever the concerns of the patient are. And then you have to continue speaking for 5 minutes till the time you're asked to stop. So the ideal way to prepare for the role play for the speaking subtest would be to practice with either your colleague or anybody else who's taking the exam, so any test taker, or you can also practice with a professional, like for example, at MedExam Expert, you can take professional help as well. If you think you're not good in English, or you need more help, or you need more practice, then it would be ideal if you take professional help. But if you think you're good enough and you just need a little bit of practice, then you can practice with your co-exam takers as well. So I think that was all about the different subtests of the exam. So any question, anything about the different subtests that are not understood? So I'll take a few questions as well. What is the recommended channel for practicing listening? I think you can hear Google Podcasts. And on YouTube also, you can find some videos related to OET listening. You can hear those as well. Okay. You can hear 2 different medical podcasts, any medical podcast that you come across. While practicing, what should be our ideal score to be on the safe side? So to be on the safe side, you should have a score of at least 30 out of 42. Okay. Is there a trick for listening and reading part B and C? These portions are very confusing sometimes. I know they are confusing, but the key to listening and reading, for reading, the key is that you have to, like I told Dr. Anam as well, basically they want you to pick the option which is the most accurate and that just summarizes the passage in short. So it has to be, if it's a little bit of ambiguity, then that's not the right answer. The answer would be the absolute correct option that would tick all of the boxes. Okay. And for listening, the key is that while you're given those 90-second time to read the question, you have to read the question very thoroughly. You have to read the answer options very thoroughly, so that once you hear the audio, you can automatically mark the correct answer. And the key to listening is, I always tell all of my students, is that remain very, very focused. If you lose track of the audio, even for a second, you'll notice you'll start getting answers wrong. So even if there's a lot of distraction going on, if you think the other candidates are talking, nobody really talks, but if they're asking any questions from the examiner, or if there's any kind of disruption, do not get distracted. Remain focused on your task. Okay. Okay.
Yeah, Dr. Huda, during speaking, you said we cannot mention anything other than the mention in the card. So suppose if asking the history, because it will make a basic point with the conversation, in conversation with the patient, like, I would like to ask some questions regarding your history. So should we say, if it is not mentioned about smoking and social habits, can we add it, or it's not necessary?
It's not necessary. I think you can add it, but do not add any medical information on your own. I hope you get my point.
Yeah, we can
For
elicit anything
example,
from the
if you're
history.
talking about thyroid disease, for instance, if you're talking about hyperthyroidism, and it's only mentioned that the patient is suffering from diarrhea or from weight loss, maybe, do not add medical information on your own. You can ask a few questions, maybe here and there, but do not add any medical information on your own. Okay.
All right. Like in symptoms, if two symptoms are mentioned, we cannot ask any of the symptom.
I think the ideal thing would be to stick to the role play card, because the problem is that I might be a doctor, but the interlocutor will not be a doctor all the time. So if you ask any complex medical terminology, they might not be able to answer that. And there you will get confused. So the ideal thing is to stick to the role play card, because they are
All right.
also trained to answer those questions which are present on the role play card. Okay. Okay. Then Dr. Sanjana has asked that according to you, how much time is required to prepare for an average student? Okay, so if you think you're an average English speaker, you can speak fluently, you can read English language properly, but still I would recommend that at least 45 days to 2 months time would be good enough. Okay, around 2 months, because preparing more and preparing well is always better than being ill prepared for the exam. Okay, Dr. Sanjana? Okay. Okay, now another question that we get asked all the time is about how to prepare, how to customize the preparation. Because if you're reading on different forums, there are a lot of tips given, a lot of preparation techniques that are given on the internet, and everybody would like to customize and to improve their study plan. Because I understand that all of you are medical professionals, you have very limited time to prepare for the exam,
Yes.
and what would be the ideal scenario for you to improve your score, and how can you score in the shortest time possible. So I've tried to add a few tips that would help you in order to customize your study plan. So the first tip that I would give you if you're planning to give the OET exam is to understand the test format before you book the exam. A lot of candidates, what they do is first they book the exam and then they start looking out for the different exam patterns and the format of the exam. I think that's not a very good technique. First, understand the pattern of the exam, understand the test format, understand what are the different subtests like we discussed right now, and what is the scoring criteria, what is the passing criteria, everything. You should know everything about the exam before you decide to take the exam. And that would just give you an insight as well if you need a lot of preparation or it's something doable for you. And that would be an insight that you would get if you know the pattern of the exam. So always familiarize yourself with the format of the OET exam, know the structure of each subtest like listening, reading, writing, and speaking, and all of the specific tasks that are required. And this will help you to understand that where you need focus, where you need to pay more attention. Then the second thing that you can do in order to customize your study plan would be to take a diagnostic assessment before you book your exam. So what you can do is you can take a mock exam and you can solve a mock exam, and you will be getting an idea of how well prepared you are or how ill prepared you are. And that would tell you your strength and your weakness at the same time. And then when you make your study plan, you can allocate your more time to the parts where you're weak, and then you can improve those subtests more as compared to the tasks that you already can perform well. A lot of candidates, they write very well. They don't really need a lot of help with writing, but they might not speak that well. So if you take a diagnostic assessment before you book the exam, that would give you an accurate idea of how prepared you are, and then you can make your customized study plan accordingly. Then the next thing would be to set a realistic goal. A lot of candidates, they come up to us as well and they tell us that my friend got the OET exam done in a week's time. My friend prepared in 1 week, but how am I not able to prepare that well in a week's time? So I think 1 week or 2 weeks or even 3 weeks is not a very realistic goal. The ideal time, give yourself time, do not rush through the exam, prepare well, make a realistic goal. I think if you plan on studying for 20 hours a day or 18 hours a day, that is not something realistic. N- Take a look at your daily working schedule. If you're working full time or if you're working part time, if you're a resident, then you would be having a very busy schedule. So always make a realistic goal by keeping your own schedule in time. Do not guilt trip yourself into taking the exam, and set a realistic goal with an adequate number of hours for preparation each day, and then plan your exam accordingly. That will really help you in combating the anxiety that you would be getting if you just rush through the exam. So it would always be ideal to set a date at a later date so that you can prepare well when once you book the exam. Then focusing on the weak areas. A lot of people, they procrastinate. So what they do is if they think that they're not that good with writing, they just tend to prepare for all of the other subtests and they delay the writing till the end. And I don't think that's a very good approach. So if you know that if you're weak at one particular subtest, start improving that from day one. If you think your speaking is not that good, you do not delay your speaking till the last week. Start speaking, start practicing your speaking subtests from day one. So that anything that you're weak in, you have time to improve those subtests. Okay. Then the next thing would be to use the official OET materials, utilize the OET materials well. We have at MedExam Expert also, we have a lot of OET preparation materials on our website that is available for all of our course students. And it is a very good standard content that you can use to prepare for your exam. At the same time, please use all of the OET preparation materials that are present on the official OET website. Always solve all of those sample tests, and that practice will really help you improve your grades. And that would really improve your test taking skills as well. Then mock exams, practice under exam-like conditions. Like I told you, the day you decide to take the OET exam, start preparing for the exam like under exam-like conditions. So mimic the time constraints, the environment of the exams, try to study in an isolated room, set a timer for each subtest, and that would really help you in improving your time management, and that would help you to reduce the stress on the exam day. And also give mock exams. The course, our students, the regular students for our OET course, we do offer them mock exams. And all of the other students also, if they want, they can take our mock exams on the OET website as well, and on our MedExam website as well. So you can contact the course coordinators and they can help you schedule the mock exam. And that mock exam is very similar to the main exam. You'll have a similar listening and reading subtest, and then you will have speaking just the way we have our regular exam, and writing just the way you do your regular exam writing. So ideally, everybody should take a mock exam before you plan to give your exam. And that would really give you a very accurate assessment of your preparation and your weak areas that you can improve. Then the last step would be to improve your vocabulary. Like I told you, whenever you study anything, you come across any new English vocabulary term or any medical vocabulary, always look up the meaning, and because that would really help you in improving your vocabulary, your medical as well as your English vocabulary. Read medical journals, articles, textbooks, anything that you come across that would help you to improve your terminologies and your vocabulary. That would really help you in preparing for your exams. Then regular speaking practice. like I told you, do not delay your speaking for the just before the exam dates. So I have a lot of students who come up just 3 or 4 days before the exam, and then they try to learn how to speak properly and they want to practice very fast. So don't do that. If you have 1 month or 45 days to prepare for your exam, start speaking from that day onwards. Find a speaking partner. You can use our OET group chat that we use for OET preparation. You can find a partner there. You can speak to your colleagues maybe, or you can also do some speaking practices on our in our groups as well, and that would really help you in improving your speaking subtest. And then getting feedback, you need to get honest, authentic feedback, because a lot of time what candidates do is they ask their friends to assess the letters. So the friends who've already given their OET, they ask them to just go through the letter and they just tell them that if the letter is okay or not. But the problem with that is that it is not, those letters are not assessed according to the original OET SAT pattern. So the OET has a very set pattern of how the letters should be assessed, what are the different criteria against which the letters are marked. So you need to get honest professional feedback for your writing as well as your speaking. And that feedback would be very, very crucial so that you can understand where you're having a problem, what are your mistakes, any mistake that you might find very minor or very meager, that could be the hindrance to you getting a good score, and you might have to take the exam all over again. For example, articles. A lot of candidates, they do not, while they're writing the letters, they do not insert a, an, and the properly. For example, it is the operation theater. For example, the right femoral artery. They do not mention the articles properly, and that is marked very negatively on the exam, because at this, while you're writing medical English, at the same time your English grammar should also be perfect. So if you're not taking professional feedback, you might just miss out on the last few points that would help you to score adequately for your professional body regulation that you need. Then the next step would be, while you're preparing for your exam, reflect and review your progress regularly. So at the end of the day, at the end of the week, sit down, make an assessment while you're writing the letters every day. Are you really improving? Are you actually improving, or you're just writing by virtue of habit? Or while you're speaking, is your speaking actually improving, or you're just speaking by virtue of the by reason of just doing it? So the way to do it is sit down, see your mistakes. Where are you making mistakes? Record your audio, sit down, review and reflect about where you're making mistakes. If you're doing your listening and you notice that you're making a lot of mistakes, sit down and reflect and see where you're having problems. Is there a problem with the focus of your, while if you're not focusing properly, or is it a problem that you're not able to understand the vocabulary, or is there something wrong? Okay, so always while you're preparing, give yourself time to reflect and review your progress, your mistakes, and then you can always seek help in order to improve your scores. So any question, anything that, I think that is all that you should be able to, that you should know at least while you're preparing for the exam. If you're planning to make your study schedule, keep these points in mind while you're preparing, and I'm sure you'll be able to prepare very well for your exam, and you'll be able to score very well. So are there any
Thank you,
questions,
ma'am.
anything that is not clear? Any
No,
question?
ma'am. Thank you.
Okay. Okay. So with this, I would also like to invite all of you to join our OET live course. We will be starting our OET live course on the 15th of January, and we will be having interactive live sessions for all of the 4 subtests. So it will be a 4-week course where we will be discussing reading, listening, writing, and speaking. And we will be having practice tests. At the same time, you will be giving mock exams, and it will be a one-on-one. It would be a session where the teachers will be teaching you, and then we will be doing live practices during the live course. So I think it would be a very, very good course for anybody who's interested and who's planning to give the OET exam. And if you think you need help with any of the subtests, you can always you can join our course, and we can do really good interactive practice sessions, and that would really help you to boost your scores. And those students who join our course, they will be provided with the mock exams as well. They will be taking mock exams as well. And the candidates who want to give the mock exams, or they want to get these courses tailored or customized for their own preparation, they can also contact our course coordinators, and our course coordinators can help you out with that as well.
Ma'am,
Okay.
can you please kindly tell how much is the fee to join this session?
Okay. Regarding the fees and the procedures of joining the course, our course coordinators will help you out with those. I think they're online on the group as well. Okay. Miss Ramesh is here. I think they're online. The course coordinators are online, and they will help you out. Okay. They'll guide you regarding the fees and how to join and what would be the detailed schedule of the course.
Miss, can we take a single module, or should it's necessary to take all 4 modules for the course?
Okay. I think our course coordinators will contact you regarding the course structure. Okay. You can just contact the course coordinators. Okay. Any other question regarding the preparation, how to prepare, or how to, if you do not understand any particular subtest that you want me to explain again, I can do that for you. Or any other question regarding exam preparation?
Miss, can we use the medical terminology during speaking?
Yes, you can. You can. You can, but you have to explain it in such a way that the interlocutor or the patient understands your vocabulary. Okay. So if you're using the phrase Hashimoto's thyroiditis, for example, you have to explain that this is a condition where the thyroid hormone is not produced properly, and you can experience symptoms like weight gain and lethargy and things like that. Okay. So if you're using a medical term, if you're using the phrase tetanus, you have to explain that it's a condition that involves the nerves and the muscles, and you can experience some spasms of the different muscles, things like that. So you have to explain while you're using the terminology, you have to explain it a little bit as well. Okay. Anybody who wants to share their experience about giving the OET exam, anything that they think I should have added or they want to add?
Please, I want to ask if the online tuition will come at a cost.
Regarding the fee structure of this course, our course coordinators will contact you, doctor. Okay?
Okay.
Okay. Okay. So are there any questions, any queries? Otherwise, we can end the session for tonight. For more information regarding our course, you can contact our course coordinators. Our WhatsApp numbers are provided. Our social media handles are also provided. And you can contact, and we can help you out with the structure, fee structure, and the schedule of the course. And if you want to get it tailored or customized according to your requirements, we can do that for you as well.
Excuse me, Miss, some people said that in writing subtest, if you take the C plus, then it's also okay, other
No.
than the B.
No. To pass, you need a grade B or above in all of the 4 subtests. C plus is not a passing criteria. For doctors, not at all. You need at least a B grade. Okay. If there are no questions or queries, we can end the session for tonight. And hopefully, I'll see you soon in our main live course, and we'll be doing some more live sessions there. All the very best for your OET preparation. And thank you so much for joining. And I think it was a useful and a very fruitful webinar for all of you. And I try to answer most of your most frequently asked questions. And if you still have any more questions or queries, you can always contact us on our social media handles. And you can join our OET free guidance group as well. And we'll try to help you in clearing your OET exam. So all the very best for your OET journey. Good night.